Thank you guys for staying around to hear this last presentation. So again, I am a physical therapist. I work on the Women and Children's campus. I am a neurological clinical specialist in the physical therapy world. I'm also dry needling certified, which a lot of our patients benefit from in the migraine population as well. We see primarily neurological and oncology population, but for some reason they typically throw all the migraine patients on my caseload. So that's why I'm here speaking to you guys today. Just a little brief history about me. I got my bachelor's in human health sciences at the University of Kentucky, and then my doctorate in physical therapy from the University of Cincinnati. So a few objectives that we'll cover today. We'll just review the current literature regarding exercise and physical activity in the migraine population, describe additional benefits to exercise in relation to migraines, some exercise recommendations, types of exercises, of course the precautions and contraindications, and some red flags to be aware of while you're exercising. We'll also talk about avoidance of exercise, because I think that's pretty relevant in the migraine population. And then I'll go through some recommendations for safe and healthy exercise, as well as a few resources for you all. All right, so busy slide here, but I'll do my best to kind of consolidate that a little bit. So there are two large studies out there looking at aerobic forms of exercise, such as brisk walking, jogging, cycling, elliptical. They even throw dancing in there as an aerobic form of exercise, which I prefer. But both of these studies are looking at the effect on migraine frequency, the attack duration, pain intensity, as well as quality of life, which I know is highly affected in the migraine population. So they have found moderate quality evidence indicating that patients with migraines, aerobic exercise can decrease the number of migraine days per month. There is anywhere between a 0.6 to 1 day a month reduction found in these studies, and again, that is on average. Some experience more, some experience less. And there's also significant treatment effects were found when comparing aerobic exercise to just maintaining your normal daily activities. And some of these interventions, again, included jogging, cycling, walking programs, or just a variety of all. There were also significant effect sizes in quality of life when looking at aerobic exercise versus just maintaining your habitual function. 4 of these studies showed significant reductions, again, in the amount of migraine days per month, the time spent in a migraine attack, as well as the 8 of these studies also support an effect size with a decrease in the pain intensity during your migraine attack when you're participating in regular exercise. There are also several other studies shown that low physical activity levels are associated with a higher prevalence and frequency of migraine attacks and other headaches, whereas higher physical activity levels are associated with reductions in migraine frequency and less migraine-related disability. So overall, aerobic exercise has been shown to significantly reduce the frequency, intensity, and duration of migraine attacks, as well as significantly improving the quality of life, in relation to migraine. Interesting enough here, just to point out that there were no adverse effects found in any of the exercise groups in any of the studies that I looked into. So that's a benefit there. Also looking at other types of exercise versus just aerobic forms. So one study looked at, now again, let me just brief this here. So there's very limited research looking at non-aerobic forms of exercise. The literature tends to lean towards those more aerobic forms of exercise. So there's one small cross-sectional community-based study looking at strengthening versus aerobic exercise. They revealed a significantly lower migraine-associated disability between those who practiced regular exercise versus those who did not. And it did not matter whether they were in the strengthening group versus the aerobic exercise. It was just exercise as a whole showed that less disability. They also looked at yoga in relation versus just your average self-care interventions, and they also noticed a significant reduction in migraine frequency in the yoga group versus the self-care group. There's a new study going on, which I'm pretty excited about as a physical therapist, looking at specific postural awareness exercises and strengthening of the neck and shoulder region. So that should be coming out within the next year. And as a physical therapist, in my experience, my patients with chronic headaches and migraine, a lot of those have that forward head, rounded shoulder posture that we're seeing so much nowadays just with computer work, phones in our hands all the time. A lot of those patients don't even have an idea that their posture is abnormal. And then when we go in and look at strength and those receptors in your neck, all of that looks impaired. And all of my patients have strongly benefited from some specific exercises for postural awareness as well as strengthening for the neck and shoulder region. So we've kind of talked about effects in regards to migraine characteristics and quality of life. But let me talk a little bit about migraine prophylaxis here. So as many of you guys are aware of the many prophylactic treatment options for migraine, such as medication, Botox, supplements, relaxation, but have we really ever considered exercise as prophylactic treatment? In a randomized control trial looking at exercise compared to the well-known migraine prophylactic treatment topiramate and relaxation, they found that exercise was actually equal to these two well-known migraine prophylactic treatments. So with that being said, you know, this non-pharmacological approach may also be an option in prophylactic treatment for patients who either do not benefit from migraine prophylactic medications or who do not want to add a daily medication into their routine. And again, I got to point out here, just because I'm pro-exercise, that none of these studies that looked at exercise had any adverse effects in these groups, okay? Exercise also does have a role in the pain modulation. So, excuse me here. Oh, sorry. Next slide here. So, let's talk a little bit about the other benefits of exercise. So some indirect evidence suggests that exercise is beneficial for migraine by causing other health benefits, such as improvements in weight management, sleep regulation, mood, and cardiovascular function, as well as improving conditions that frequently exist with migraine, such as obesity, hypertension, sleep apnea, depression, and anxiety. Exercise also plays a substantial role in that modulation of pain processing. Back to what Dr. Wells was saying, how that threshold is kind of increased if you're doing other things to kind of decrease those triggers in your life, and exercise does help that pain threshold. And then compared to a lot of other treatments, exercise is available to all, costs very little to nothing at all, and has those other general health benefits to be aware of. So looking at all of the research, specifically in aerobic exercise, just because that was the strong recommendation in the literature that I found, so I'm going to talk a little bit more about that moving forward. They use the American College of Sports Medicine's recommendation to base their parameters with their research. And then, so aerobic exercise is a moderate intensity training performed over a period of time, 20 to 30 minutes at a time here. The guidelines for a healthy adult can be used in patients with migraine as long as underlying health conditions do not require specific exercise limitations. Some of those that we think of are the cardiovascular risk factors, so definitely check with your doctor if you're concerned about any other conditions. So the American College of Sports Medicine says that all healthy adults age 18 to 65 should participate in moderate intensity exercise, about 30 minutes on 5 days a week, or a minimum or a higher intensity exercise for about 20 minutes on 3 days a week. I think it would be great if you could mix some of those up if it's within your, safe exercise practice here. And then, so let's talk a little bit about the parameters. So they say, again, 5 times a week for that moderate intensity, 3 times a week for vigorous intensity, We think of moderate intensity as more that brisk walking, possibly jogging, swimming, elliptical trainers. That higher intensity, more of your HIIT training, high intensity interval training, or the running. So we'll talk a little bit more about moderate intensity again, because that's what the literature is recommending. So that moderate intensity is based off of a percentage of your maximum heart rate, okay? So they say about 64 to less than 77% of your max heart rate. So how you would find this is you would take 220 minus your age, and then you're gonna multiply that by that 0.64 and 0.77 to find your ideal exercise heart rate range. If you have any questions about that, I've got a slide with my contact information at the end, or I can hang out and we can kind of discuss how to find those parameters for you. But that would be how you can kind of maintain that safe, healthy exercise. Again, moderate intensity, about 30 to 60 minutes at a time. If you're someone who's newer to exercise and that 30 minutes is intimidating to you, it's great to just start with 10 to 15-minute bouts of exercise and try to work yourself up throughout your day, okay? Okay, let's see. So 4 components to be aware of that are extremely important during exercise. A little warm-up period to start gradually increasing your heart rate and your blood pressure. 5 to 10 minutes of just whole body movements, you know, just some dynamic stretching, walking. If you're liking strength training, do your strengthening exercises with no weights or a little bit of weight before you get started. And then you can move into your conditioning, whether you're doing some aerobic exercise, some resistance exercise, or even sports activities. Still good to warm up before you do all of that. And then a cool down phase to make sure you're lowering that blood pressure, lowering that heart rate at a steady state as opposed to just stopping. Just stopping that exercise can lead to exercise-induced headaches, as well as just starting right up really quickly with exercise and not gradually warming it up can lead to those headaches or even injuries or soreness, excessive soreness after. And then stretching. I always say, you know, stretch either before or after your warm-up period or after your cool-down period. Stretching is typically most effective when our muscles are warm. But if you're doing a lot of strengthening exercises or walking or running, try to stretch out some of those muscles that you used after, just so you don't lead to any pain or injury after. So types of exercise, and again, I am 100% with Dr. Wells when you say, find something you enjoy. It doesn't have to be a structured walking program. It doesn't have to be a structured strengthening program. It can be a sports activity, dancing, swimming. Anything that elevates that heart rate a little bit, gets you moving, gets the body moving, is good for you. So just do something you enjoy and will stick with. But here's just a few types of exercises. In that aerobic category, which is the strong literature recommendations here, you've got just brisk walking, jogging, again, swimming, dancing that I kind of mentioned in the beginning, definitely one of my favorites in there. And then strengthening, you've got your weightlifting or your body weight, which is that calisthenics category, push-ups, sit-ups, dips, things of that. And then probably one of my favorite areas here is the flexibility, yoga. I cannot speak highly enough about the importance of flexibility, body awareness, posture awareness, relaxation, and just, you know, that mind-body connection that yoga can bring to you. And if you're one person that typically likes to do one of these forms of exercise, I encourage you to switch it up a bit. Try to get a little bit of aerobic exercise in there, and then on top of that, try some flexibility stuff. Maybe even try some strengthening exercises for those back muscles to get you out of this position here. So along with that, we of course have to talk about just some things to be aware of if you are participating in exercise. Again, so ensure clearance from your physician for any medical conditions, especially those cardiovascular conditions that might contraindicate or require increased precautions or monitoring with exercise. You can consider working with a therapist or an exercise specialist if you're thinking that you're concerned about your tolerance. Also to clear with your physician if you're thinking about starting with vigorous intensity exercises, especially if you're not one who's exercising on a regular basis. Avoid the exercise in the presence of migraine. Avoid exercise in the presence of migraine triggers. So if you're someone that's triggered by specific odors, heat, bright lights, loud noises, try to exercise in an area where there's not a whole bunch of triggers. Even if your migraines are not vestibular in nature, you can be considered at an increased risk for falls, just for those visual disturbances, pain, lack of awareness of the environment when you are in that attack. And then some signs to consult with your physician if you have experienced changes in your headache patterns or characteristics with exercise. Your symptoms become aggravated with exercise that was once well tolerated. If you exhibit increased migraine signs or symptoms after exercise, and some of these are, increased thirst, depression, constipation, diarrhea, vomiting, things of that nature. You become pregnant, or your headache is aggravated by a cough or that Valsalva maneuver, anything that increases that abdominal pressure. And then red flags to be aware of. Now, these are red flags to be aware of, period, but definitely during and after exercise. If you have any new neurological signs, problems with your speech, vision, balance, or walking, you have a sudden onset of the worst headache of your life, personality changes or abnormal behaviors, uncontrolled hypertension, or headache accompanied by neck stiffness and fever. Okay, so now we need to address a few common beliefs associated with migraines and exercise. So on average, individuals with migraine have lower daily physical activity and lower fitness levels than those without migraines. Some common reasons for avoidance of physical activity are fear that physical activity can trigger an acute migraine attack, or fear that physical activity will exacerbate pain during a migraine attack. Now, looking at the studies, according to a study done in women, again, there's a lot of studies that looked at women as their primary population because there is a 3-to-1 ratio of migraine sufferers, the female to male ratio. 78% of this sample avoided physical activity to manage their migraine attacks in the past month, and 88.5% of these individuals reported avoidance of both moderate and vigorous activity. Now, this avoidance was due to fear that the activity was going to trigger a migraine attack, but only about 20 to 45% of people actually experienced a migraine attack after exercise, and only 20 to 38% of these people experience this phenomenon reliably. So overall, we look at it as we're fearful that exercise is going to cause our migraines, but in return, avoiding exercise and physical activity can lead to that lower migraine threshold. It can lead to lower activity levels, higher likelihood of other associated conditions such as increased weight, problems with sleep, like Dr. Wells was talking, that overall brain health. Exercise is a very important factor in the overall brain health. So if you're someone who feels like exercise triggers your migraines or causes more pain during those migraines, I highly recommend starting with a low volume of exercise at a low intensity. Start 10 to 15 minutes of a walking program on a non-headache day. See how that does for you. Challenge those beliefs that exercise is going to worsen your migraines. And you can even journal about these things to see how exercise does affect your day-to-day function as well as your pain. So exercise is a trigger here. One study indicates that individuals are more likely to experience migraine after those exercises of higher intensity levels, and also exercise without with an insufficient warm-up period. Okay, so again, if you're one who's very fearful that exercise is going to increase your migraine, try that moderate intensity, that 64% to less than 77% of that maximum heart rate. And then you can start to increase your volume, increase your intensity as tolerated. And then that warm-up period again. Oh, did that go off? Can everybody hear me okay? Okay. But also, too, remember that warm-up period to gradually increase your heart rate, okay? A review article found that a higher prevalence of exercise as a trigger for migraine after, again, that intensive aerobic exercise, running, also in areas of warmer weather and higher altitude. So be aware of your environment that you're exercising in. Your exercise program should remain at a tolerable level, and the environment should be considered. Again, going back to that journaling, if exercise seems to be a trigger for you, journal about it. Try different types of exercise. Try walking, cycling, indoors, outdoors. Try yoga. Try some strengthening exercises and kind of see what's best for you. If exercise consistently brings on more migraines and headaches, I would consult with your doctor about that. And then it's never a bad idea to kind of take your blood pressure before, during, and after exercise just to see how your blood pressure levels. I know that underlying uncontrolled hypertension can be a risk factor for migraines. So this is what you guys came for, tips for exercising safely. So build up to it. Whether you're new to exercise or you're starting back on your routine, use that progressive approach. Start with that 5 to 10 minutes and then work your way up. This can help you learn more about your body and how it tolerates exercise. 5 to 10 minutes of a warm-up and a cool-down period, highly recommended. Hydration. It is so important to stay hydrated before, during, and after your exercises. Consider your environment. If you're in a hotter place, make sure you're wearing cooler clothing. Cooling cloths are great. Drinking plenty of water, taking rest breaks as needed. Then nutrition. Nutrition is also very important because exercise lowers your blood sugar, and low blood sugar can be a trigger for migraines. So the American Migraine Foundation did make a recommendation to eat about 90 minutes prior to an exercise and eat foods that are higher in protein. And then posture. I can't speak enough about posture, but watch your posture during exercise. You know, make sure those shoulders are back, that head is back, you're looking up and kind of forward if you're doing walking or jogging. And then if you're doing strengthening exercises, make sure that you're not overdoing it in the neck and shoulder region, causing more stiffness, pain, because that can contribute to migraines or headaches. So a few good resources. The Norton Neuroscience Institute has a lot of great online classes and in-person classes as well. If you're interested in yoga, Tai Chi, Feldenkrais, a lot of those help with body awareness, postural awareness, flexibility. The link is up there if you're interested. And don't underestimate the power of YouTube. I'm not gonna lie, I find a lot of great yoga videos, posture awareness, stretching videos. And then if you're interested in starting to do some strengthening, you can get on there and they can show you a few good strengthening exercises and talk about form. Walking. The best exercise you probably could do for yourself is get out, walk. Talking about the power of nature in the migraine population. Walk outdoors, find a park. I know it's kind of getting colder out right now, so we're a little limited with the weather. The mall. Great place to start exercise. There's lots of benches around the mall if you need to take rest breaks. It's fairly populated. Gym memberships. There's a few local gyms. I know there's a Planet Fitness and a Crunch Fitness out there with $10 memberships. A lot of these places also, too, have instructors that can show you the exercise equipment, how to use it safely. Physical therapy. If you've got any abnormalities in your posture, you tend to be one with forward head, rounded shoulders, you've got any impaired strength of the neck and shoulder region, pain and tension, a lot of that can be addressed in therapy. If your doctor has concerns about your tolerance to exercise, an exercise specialist or a therapist as well. And then my challenge to you guys, if you're not one that typically is exercising or getting physical activity throughout your day, just find some ways to work it in. Set a step goal for yourself. Park a little further away at the store. Get a few more steps in. If you have a little bit longer of a walk that day, try to vary your walking speed. Do a little slow, a little quick, as long as it is safe for you. Take the stairs instead of the elevators. And then if you've got a job that requires you sitting at a desk for a while, try to break that posture every hour. Try to get up, try to move around, whether you're walking, whether you're standing and just marching in place. Anything is better than sitting all day long.